Let's have a very quick recap of the new terminologies which have been assigned by FIGO recently for abnormal uterine bleeding. Abnormal uterine bleeding can have four components which are disturbed. First is cycle frequency, which can be frequent. Previously, it was called as polymenorrhea. Now we call it as frequent menstrual cycle when it is occurring at less than 24 days interval. Normal cycle frequency is 24 to 38 days, and if it is occurring at more than 38 days interval, it is known as infrequent cycle, and previously it was also called as oligomenorrhea. Second cycle disturbance is regarding the duration of flow. So duration of flow normal is from 3.5 days to 8 days. So if it is between 3.5 days and up to 8 days, it is normal. If it is more than 8 days, it is known as prolonged flow or prolonged duration of menstruation. Third parameter that we must remember is regarding the amount of flow. So amount of flow normal is somewhere around 5 milliliter to 80 milliliter per cycle. If it is less than 5 milliliter per cycle, it is known as light menstrual bleeding. If it is between 5 to 80 ml, it is normal bleeding, and if it is more than 80 ml, it is known as heavy menstrual bleeding. Previously, light menstrual bleeding was also called as hypomenorrhea, so now it is known as LMB or light menstrual bleeding, and heavy menstrual bleeding was also known as menorrhagia. Now the term has been replaced by heavy menstrual bleeding. Regarding prolonged menstruation or prolonged menstrual bleeding, previously it was called as metrorrhagia. Now we don't call it as metrorrhagia, but instead it is called as prolonged menstrual bleeding. Now we earlier used one term which was known as menometrorrhagia, which was a combination of heavy and prolonged menstrual bleeding. Now it is very conveniently called as heavy prolonged menstrual bleeding. Now, one more thing that we must know regarding the abnormal uterine bleeding pattern is intermenstrual bleed. So, intermenstrual bleed may be completely absent, which is quite normal. It may be present, but in two patterns. So, one pattern is random, that is, intermenstrual bleeding is occurring at any time in between two menstrual cycles, and one is having a cyclical and predictable occurrence during the menstrual cycle. So, the cyclical and predictable intermenstrual bleeding is again subdivided into three categories, that is early cycle intermenstrual bleed, mid cycle intermenstrual bleed, and late cycle intermenstrual bleed. Fourth component is regarding the regularity of the cycle. So regularity of the cycle, regular cycles are termed when the difference between longest to shortest cycle is around 7 to 9 days, and it is known as irregular cycle pattern if the difference between longest and shortest cycle is more than 10 days.